Sincere appreciation for the vision, knowledge, and leadership that you have brought to the field of restorative natural medicine and the advancement of health freedom. And it's dated February the 26th, 2006. Would you join me in congratulating him for his accomplishments?
I can start by saying this morning I had a meeting with someone that I have admired and worked with for years and years, Mr. Miller, Clinton Miller, and he helped me put some things into perspective. What is happening here is something that is beyond what many of us can grasp. When a small facility that maybe at its best is treating 400 to 500 people a year can cause as much consternation among a country of 200 plus million people, it overwhelms you a little bit. And when that can reach the proportion that the United States government is so concerned about that little facility that they can place enough pressure on a foreign country to put its license to operate in suspension, you get even more concerned. I can tell you from personal history of my past with the government and their attempts to, I'm going to use the word censure what I do and say and believe in. And I can tell you that they will tap your phone lines, they will go through your garbage, they will go through your trash in your office, they will spend years following you wherever you may go, and all of that you are paying for. The last go-around I had with the United States government cost them, by their own admission, something like $5 million. They spent over 5 years attempting to get, in the words of the U.S. attorney who was in charge of this, to put me away for 18 years. After 6.5 years of legal wrangling, and he was going to do that because he was sure that I was using insurance fraud to bill patients who were going to the hospital I'm affiliated with. They took all of the records and they went through every insurance that was billed for 3.5 years. They meticulously went through every entry. And in that period of time, they found not one single incidence of overbilling. I challenge any hospital in the United States to take that same scrutiny. I was, of course, relieved. I mean, I don't do the billing. I didn't know what they had billed for, but my instructions have always been, don't bill for anything we don't do and don't bill for anything questionable. It's just that simple. There's no use asking for trouble. Anyway, that went on for some time. They dropped the 18 years that they were going to put me away down to under 10. And of course, that slowly came down as the years passed, and we ended up with a 3-year probation period for conspiracy. I want to make it very clear. All of the allegations that you've seen printed and so forth, that I was put in jail for smuggling drugs and so forth, that's not true, my dear friends. I did not evade taxes. There was no evidence presented that I evaded taxes. I conspired to evade taxes. That means I thought about it. And I possibly was guilty of that. I don't know for sure. But I also conspired to smuggle drugs to my patients. But I was never caught smuggling any drugs, and I never did. I mean, there were ways for the patients to get their medicines, and those were open to them, but the rationale of the U.S. Attorney was that if Kurt Donsbach hadn't been affiliated with that hospital down there, there'd have been no need for those illegal drugs to come across the border, medicines. And incidentally, the one medicine that they were more interested in than anything else was a medicine that historically has been used as a vermifuge. If you know what a vermifuge, it's an anti-parasiticide, in other words. And I read in some rather remote journals of its experimental use in colon cancer and the fact that it was quite beneficial, but because it was a very inexpensive thing and there was no push on it from any drug, none of the oncologists knew about it or anything else. Anyway, 3 years after they started the action against me, and one of them was the accusation that I used this vermifuge for treatment of cancer, the official compendium for oncology listed that particular medicine as one of 2 suggested medicines for use in colon cancer. We do not use far out, funny things in our approach to cancer. As those of you who were here yesterday, we use hyperthermia. The medical institutions are researching hyperthermia all over the world in the treatment of cancer. We use things that are that inhibit cancer's ability to make new blood vessels, which it needs to grow, anti-angiogenics, and yet all around the world, it's the hottest research thing there is. Nobody has just found something that they can create a huge profit on. For those of you who have not read my newsletter, please do. My new newsletter, Holistic Life, it's downstairs at the booth if you want it. I just make an example. Many of you are taking Lipitor. Lipitor sells for approximately $235 per 100 tablets. That's the drugstore price of that particular product. Now, of course, you're getting it at a discount because you have an insurance that pays at least part of it. But who's paying for the insurance? You can think about that. Anyway, the total cost of Lipitor is about $4 per 100. Now, that includes packaging, making it, the raw ingredients, and everything else. Claritin, the new non-nausea drug, 71 cents for 100 tablets, and you're paying over $180 for 100. I mean, it's an amazing, amazing profit structure. But see, if you bring in something that doesn't cost anything, there seems to be a real problem on getting it promoted to where individuals who are in charge of your medical care will use it. Now, the amazing thing is brought out by Mr. Miller this morning in one of these things that he had listed. 27% of the American public believes that there is a cancer cure out there that the medical profession will not use. If 27% of you believe that there is something out there that can help you, why are you not bashing your doctors in the head and saying, will you please get with it? Come on, it's my life at stake. Now, interesting, I also benefit Mr. Miller for this. This is a direct quote, and please listen to this, because we are today challenging this quote. Were patients to return from Mexico cured and doctors saw the unbelievable results, we would pursue it. But we just don't see it, says Dr. Jack Lewin, Chief Executive of the California Medical Association. We don't have patients coming back with miraculous cures. I've got some people here today that I am going to present to you, and if there are those of you in the press here, please make note of these people. Please know that we can document their records thoroughly, And we're going to present these to Dr. Jack Lewin and ask him to do just what he said, to pursue the records and see whether or not there is miraculous cures available. Because I'm sorry, the guy stepped over the line. He issued us a challenge. We're going to answer that challenge. Now let's see what his answer will be. We're here to answer the Coretta King death situation. I would like, and believe me, I've learned a long time ago, that you have to have, much as we all joke about them, but you have to have legal advice on some of the things that you say. And as many of you could understand, there is a tremendous amount of pressure on us to try to reopen our facility in Mexico. And so I don't want to say anything that would jeopardize that. And I have asked our attorney, Mr. Negretti, Carlos Negretti, to comment on that particular situation. I do want to say this. Mrs. King is not the first celebrity who has visited our facility. We have had many. She just happens to be the first one that passed away on premise. We didn't have a chance to treat her. The lady was very, very ill when she came, and as all of the press reported, the family reported, we never had a chance to even really institute treatment. We were just trying to make her comfortable and keep her alive during this period of time and determine what was going on in her body. The King family stands foursquare behind us, says that our facility was a wonderful facility. The doctors were the best doctors they had ever had contact with, and so forth. So what is all this furor about, ladies and gentlemen? Where did it come from? I don't have an answer to that. It's the history of the world that you have to have a cataclysmic event, and in my life this is a cataclysmic event, believe me, to create change, and maybe this can be the turning point. I would like to just point out, I think the crux of this whole thing was stated by Dr. Benjamin Rush, who was one of the signers of the Constitution of the United States. Also happened to be a physician. He said, unless we put medical freedom into the Constitution, the time will come when medicine will organize into an undercover dictatorship to restrict the art of healing to one class of men and deny equal privilege to others. They will constitute the Bastille of medical science. All such laws are un-American and despotic and have no place in this republic. The Constitution of this republic shall make a special privilege for medical freedom as well as religious freedom. And my dear friends, that's really what it's all about. I don't care if there are those of you who wish to buy into the cause of allopathic medicine and wish to have surgery and chemotherapy and radiation for cancer. Be my guest. I have a patient here who's going to talk in a few minutes who for 2 weeks refused one of our treatments, and we never said a word. Am I correct? You can tell your story. As Carlos said, people are intelligent who come to Mexico. We don't have people with a third-grade education coming to Mexico. We've got people who have gone to the internet, who have talked to sometimes as many as 50 or 60 of our ex-patients before they make the decision to come. But when they make that decision, don't you think they have a right to do so? It is an absolute inherent right in the pursuit of life, liberty, and happiness, guaranteed by our Constitution, my friends. Somewhere in our government, we have people who want to take away that liberty from you.